One Breath, Recognize and Manage Breathing Problems, Anatomy and Physiology of Breathing for Law Enforcement Personnel by Brian Casey. I first created the One Breath presentation for a group of officers in 2015. Police officers can't be expected to have the level of knowledge and experience that paramedics do, for example. Both of our jobs have become increasingly complex and sometimes have conflicting priorities. The respiratory system is complicated and in some ways counterintuitive and beyond what an officer would normally be taught or expected to understand without some additional focused training. I know that people working in law enforcement have a range of first aid or EMS training, skills, and experience, from the most basic to paramedic level and beyond. For some, responding to medical emergencies is a big part of their job. For others, it's a rare event. Some squads are equipped with oxygen, AEDs, etc. Others have no first aid equipment. This short One Breath video presentation will be helpful to the full range of law enforcement personnel by focusing on the fundamentals of understanding how breathing works, recognizing breathing problems, and what police officers with a range of EMS experience and equipment can do to manage them. I'm confident I can help you because of my education and experience. I'm a police sergeant, a health educator, and a former paramedic. I worked as a street paramedic and EMS educator for 20 years before I became a police officer. Additionally, I have some training and in-depth study in the area of in-custody death prevention. As a disclaimer, I want to remind you that you're hearing from a police officer, a health educator, and a former paramedic. I am not an attorney or a physician, and this is not necessarily advising on policies or procedures. The views and opinions expressed here do not represent the official policy or position of the police department where I work. As an overview, the following is what I hope to do. Explain how ventilation and respiration work together to accomplish what we commonly think of as breathing. Also, I'm going to describe normal and abnormal breathing and some best practices to manage breathing problems that require no equipment. As law enforcement officers, we know this. We encounter people who are sick, injured, or who have significant pre-existing medical conditions. Officers must sometimes use force to capture, contain, control, or restrain people. And in some situations, the officer or the subject's actions may interfere with the subject's ability to breathe normally and to maintain good oxygenation. So an enhanced understanding of how breathing works is vital to good police work. We might come to some of these situations with some dangerous misunderstandings. I'll list them here. It's wrong to believe that a small amount of air or air movement or an occasional breath is enough for adequate respiration. One breath does not necessarily equal adequate breathing. Talking does not necessarily equal adequate breathing. And compliance and death can look similar. Let's start with how breathing works. Breathing involves both ventilation and respiration. Ventilation is air movement in and out of the lungs or chest. Respiration is a gas exchange. Those two gases are oxygen and carbon dioxide. Ventilation and respiration work together to accomplish what we think of as breathing. And all of this is required, obviously, to sustain life. Ventilation is air movement. Respiration involves the exchange of gases in the lungs. Respiration, unlike ventilation, is a tiny process that occurs at the cellular level and involves two gases and two tiny structures. The two gases are oxygen, or O2, and carbon dioxide, CO2, and the two structures are the alveoli and the capillaries. Ventilation and respiration work together to accomplish what we know of as breathing. With ventilation, air moves in and out of the lungs due to pressure changes inside the chest. The two actions to accomplish this are inhalation or exhalation. We inhale or we exhale. During inhalation, the intercostal muscles, which are small muscles attached to the ribs, and the diaphragm, which is a big flat muscle, contract. The muscle contractions cause the ribs to change angle and the diaphragm to move down, which expands the chest. When the chest gets larger, it sort of pulls the lungs along with it, stretches them out, expands them. An enlarged chest and lungs creates a decrease or negative pressure inside the chest. Air gets sucked in. With exhalation, all these actions are reversed in the sense that those muscles relax, the ribs return to their normal position, and the diaphragm moves up. This results in the chest becoming smaller, so the pressure in the chest increases and air gets pushed out. Air pressure changes within the chest and lungs can be illustrated with a bellows. You may be familiar with a bellows, the tool that can be used to stoke a fire, for example. As you pull the handles apart, the bellows becomes increasingly larger, creating a negative pressure that sucks air in. When you push the handles together, air gets pushed back out. With inhalation, the chest gets bigger, air gets sucked in. With exhalation, the chest gets smaller, air gets pushed out. Chest gets bigger, air gets sucked in. Chest gets smaller, air gets pushed out. Air gets sucked in, air gets pushed out. Respiration, unlike ventilation, is a tiny process that occurs at the cellular level. It involves two gases and two tiny structures. The gases are oxygen and carbon dioxide. The two structures are the alveoli and the capillaries. Oxygen can be thought of as the good air or fresh air. Carbon dioxide can be thought of as the waste air. Now, carbon dioxide serves a critical function in breathing regulation. For most people, the body uses an accumulation of CO2 in the bloodstream as a signal to the brainstem when to take a breath. Not what you might think, that we only involuntarily breathe when our body senses low oxygen. Instead, the body uses high CO2 to signal the next breath. Getting oxygen in the body is critical to adequate breathing, but so is getting rid of carbon dioxide. The structures are the alveoli, which are part of the lungs or airstream, and the capillaries, which are part of the bloodstream. Alveoli are small, thin-walled, balloon-like air sacs located at the outer portion or branches of the lungs. The capillaries are small, thin-walled meshes of blood vessels located all over the body, where the artery and the vein transition into and from each other. The system is trying to get oxygen to the bloodstream and carbon dioxide to the airstream. To review, breathing involves both ventilation and respiration. With ventilation, we have both inhalation and exhalation. With respiration, we exchange two gases, oxygen and carbon dioxide, at the site where the alveoli and the capillaries meet. Ventilation is a big mechanical process. Respiration is a tiny chemical process. Let me now describe normal and abnormal breathing. If you understand what normal breathing looks and sounds like, you will be better able to recognize and respond to signs and symptoms of abnormal breathing. Normal breathing includes breathing at rest, where you have a low oxygen demand. There's also breathing during exertion or exercise, when the body has a high oxygen demand. There's also breathing during recovery, following exertion, where the body will, at least initially, have a high oxygen demand. These are all normal breathing processes, even though breathing during and after exertion include heavy, rapid breathing. Normal breathing at rest is usually effortless and quiet. Adult breathing rate at rest is between 12 and 20 breaths per minute. Infants and children breathe faster. Knowing this, consider some general rules about breathing. If you notice someone's breathing, there might be a problem with their breathing. Remember, normal breathing is usually effortless and quiet. Breathing can be difficult to assess and can even be challenging for some medical personnel. Unconscious people who are dying sometimes fade out slowly and may have a gradual lessening of their breaths. Normal breathing at rest can sometimes appear shallow, but shallow breathing can also be a sign of serious trouble as well. This is especially alarming in people who are unconscious or who have a decreased level of alertness. In these people, it is important to be concerned about the adequacy of their breathing. Exertion creates an increased need to take in fresh air or oxygen and to get rid of the waste air or carbon dioxide. It's normal to breathe heavily, deep, and rapid during and after exertion. Allowing for good ventilation or air movement will allow for good respiration and thus recovery. We may have heard people in the process of recovery say, "I can't breathe," or even said it ourselves. But as people recover, normally that sensation of being air-starved should gradually go away. Abnormal breathing can be the result of illness or injury. The illnesses could include pre-existing medical conditions or even drug use. Body position can also negatively affect breathing. Those who are physically compromised, in poor physical condition, or obese may suffer more difficulty breathing while lying down. Injury can also be a factor, especially to the torso, remembering that the torso includes the back. Injury to the abdomen or abdominal pain, which is involved in breathing as well, can also affect breathing. Furthermore, as we think of people who are sick or injured, we recognize that they may have an increased anxiety and fear, which may also impact breathing. Some signs and symptoms of breathing problems include rapid breathing, slow breathing, shallow or irregular breathing, noisy breathing, flaring nostrils, skin color changes and sweating, anxiety or fearful facial expressions, restlessness, agitation, and confusion. I mentioned this before, but sometimes people state that they can't breathe. That sensation or feeling can be the brain receiving signals that it does not have enough oxygen or too much carbon dioxide in the blood. This can occur despite an open and clear airway, because there could be some other medical problem going on that may not be obvious. When EMS personnel take care of people, they do a couple of things. Besides airway and body positioning for best airflow, they often give supplemental oxygen for people that are ventilating or moving air. And for those who are not breathing adequately or not breathing at all, they will take over their breathing for them and do positive pressure ventilation. I want to make some additional comments about brain function. Anxiety, fear, restlessness, agitation, and confusion can be the result of poor brain function due to hypoxia or low oxygen or hypercarbia, high carbon dioxide, or other medical conditions. A suspect's mental confusion can be an early sign of inadequate breathing, and this may not be easily recognized by the officer. We know that a suspect's failure to cooperate or comply with verbal orders can be a ploy that creates an increased safety risk for officers. Officers must be careful not to be fooled. But we must also recognize that some obstructive behavior might have medical causes. A review of normal and abnormal breathing. Normal breathing involves breathing at rest, during exertion, and at recovery. Abnormal breathing can be a result of illness, injury, or pre-existing conditions. I want to repeat some common misunderstandings about breathing. They include the false belief that a small amount of air movement or an occasional breath is enough for adequate breathing, and that being able to talk means the person is breathing adequately. Also, be warned, compliance and death can look similar. We know that breathing requires both ventilation and respiration at an appropriate rate, depth, and air quality. A few breaths or gulps or gasps of an unconscious person should not be mistaken for adequate breathing. And abdominal movement alone should not be mistaken for adequate breathing. Both of these can be signs that death is near. For talking to occur, air must move past the larynx or voice box in the throat. For respirations to occur, air must move to and from the alveoli deep in the lungs. You may have noticed that people who are short of breath speak in only short sentences, 1 or 2 words at a time. Paramedics recognize that a patient who talks in short 1 or 2 word sentences is having medical problems. Talking requires air moved down into the voice box, a relatively short distance. For true breathing, ventilation, and respiration, air must get down into the lungs. Talking, breathing. Talking, breathing. I mentioned earlier that compliance and death can look similar. Let me explain that in more detail now. People who are acting extremely agitated or aggressively disoriented could be experiencing a true medical emergency, which requires EMS care and likely sedation. Officers may be called to identify, contain, capture, control, or restrain those suffering these events. In these cases, the police may be arriving at a medical emergency that looks like a behavioral emergency or a crime. Physically controlling these people and other non-compliant or violent people can require an enormous amount of physical force. Officers must understand the risks and ways to minimize those risks. While applying force, officers must not erroneously mistake unconsciousness for compliance. In the struggle to physically control a person, officers might overlook this critical decline in condition. What may appear like hard-won compliance may in fact be death or the process of death, because dying people sometimes fade out quietly. Let me review some of the fundamentals of breathing problems before we go on to the important practices when dealing with them. Adequate breathing requires both ventilation and respiration at appropriate rate, depth, and air quality. If you notice someone's breathing, there might be a problem with their breathing. A single breath, a gulp, or gasp for air are signs of serious trouble, and the officer must do something to help. Additionally, we must know that talking may not necessarily equal breathing, and unconscious people who are dying sometimes fade out slowly and may have a gradual lessening of breaths. Important practices. Some of the things that we can do to help people with breathing problems is to manage their upper airway. This is especially important for those who are unconscious or who have a decreased level of consciousness. Simple hands-on techniques that require no equipment can be used to maximize airflow through the nose, mouth, and throat as we wait for the ambulance or EMS. Care can range from reassuring them to simple body and upper airway positioning to full CPR. The most important things to do require no equipment. First, we must recognize when there is a problem, call for EMS, and take action to help them move air as freely as possible by one or a combination of the following techniques. I will give a brief description here, but doing these correctly can be a bit tricky and requires some practice with experts to master. The hands-on techniques include head tilt, chin lift. This is when you tilt the head back and lift the chin to basically create a straighter air passage through the mouth and nose down to the lungs. This can also lift the tongue and other soft tissues out of the way. The jaw thrust creates a sort of exaggerated underbite. It is used on people we think could have neck or back injuries and we don't want to move their head. The log roll may be necessary if you have to clear the airway of something. This is when we roll them onto their side as a unit, keeping the head and neck aligned with the body. Ideally, this is done as a coordinated effort of 2 or more people. The recovery position is essentially placing someone on their side to allow for good airflow and drainage from their mouth and nose. The arms and legs are positioned in a manner that allows the recovery position to be stable. There is also clearing the airway of obstructions and CPR as well. You can see that my list also includes demonstrating compassion. What to do when a conscious person complains or demonstrates breathing problems. First of all, don't say or do anything thoughtless. Breathing problems can cause significant anxiety in those with the problem and those nearby. So take care not to express your own anxiety in thoughtless words or actions. Provide fresh air and allow for good ventilation. This can include loosening tight clothing or anything that may restrict their breathing. Call for EMS if requested or concerned. Simple acts of reassurance and attempts to calm them are very important. Not only is it compassionate, but calm people generally have a lower oxygen demand. So if a person is having a medical problem, one thing we can do if we can't give supplemental oxygen or in addition to supplemental oxygen is to try to decrease their demand for oxygen by helping them to stay calm. For anybody, whether they're conscious or not, let's say they're on the ground, we may want to kneel down near them and put our hand on their shoulder and tell them that help is coming and that we'll stay with them. Things to do for people who are unconscious or who have a decreased level of consciousness or alertness. Always request EMS. Assure an open and clear airway while also protecting the spine of those with possible neck or back injuries. For those who can be safely rolled onto their side, position their body in the recovery position as recommended by the American Heart Association. Reassure them as previously stated. What to do when you don't know what to do. Our job can have a lot of demands, and we may not always be sure what to do, but we are all expected to do something helpful. Recognizing that sometimes there is not much to do, even with some seriously sick or injured people as we wait for EMS, but we have to do something. So what to do when you're unsure? Request EMS for expert help. Demonstrate concern. Recognize the value of a team approach in solving problems and caring for the sick and injured. Professionally manage any anxiety you or your coworkers have. Be very careful what we say and do when nervous or stressed. Let me just summarize by saying this. Ventilation and respiration work together to accomplish what we commonly think of as breathing. Breathing problems can be an early or late sign of trouble, and protecting people from harm includes understanding how breathing works. Thank you for listening. I hope you found this helpful. My name is Brian Casey. You can find out more about me and some of the other things I do at goodcopgoodcop.com. You can also send me an email at brian@bluewatchrollcall.com. If you enjoyed what I had to say and how I said it, you may be interested in my book, Good Cop, Good Cop, a Get Healthy, Stay Healthy guide for law enforcement. You might also want to check out my Cop Think podcast, where we answer the question, why do the police do what they do? Again, thanks for watching, and remember, do good work out there.